Hi, our research project is about artificial intelligence in healthcare in Australia, submitted by myself Ayesha, Mr. Aruna, Sairam, Manjunatha, and Ms. Pooja Dhopeshwar under supervision of Dr. Mukesh Prasad. To start with, first we will see how artificial intelligence is injecting in healthcare. As we know, artificial intelligence in healthcare means training robots or applications to act as human by adopting human skills. The executive survey by Accenture shows how organizations are looking to extend the proportion of AI applications to increase the demand for AI in healthcare and to encourage early adoption techniques and tools to develop using AI. About 13% of organizations are highly focused, whereas 27% of organizations are quite focused. 53% of organizations are moderately focused, and 6% are minimally focused. Next, we will see how value of AI is predicted in healthcare applications. The bar graph is the result of studies by various healthcare applications. About 56% of AI applications have increased cybersecurity and operational efficiency. About 50% of applications in today's era are currently built have improved analytical capabilities such as patients identification and personalized treatments and management. AI has not only taken over healthcare, but it has also been cost effective, providing labor, providing access to care regardless of outcomes, and about 6% of clinical outcomes are increased. In this research, we have mainly focused on three areas. Those are academic contribution to AI in healthcare, industry contribution to AI in healthcare, and government contribution to AI in healthcare. My contribution to this research is in academic sector in healthcare in Australia. First, we will see the medical machine learning research by the University of Adelaide. There are about four current projects. The first one is deep reinforcement learning for discovering and visualizing biomarkers. The main purpose of this extended research is to provide efficient analysis of huge inputs for optimal biomarkers. Next study is about automated analysis of multimodal medical data using deep belief network. This study is to provide accurate results to have better diagnosis of breast cancer. The next study is about automated polyp detection and classification. This study is mainly focused to eliminate the traditional process, which is very time consuming and requires huge data sets. By conducting this study in the university, they have come up with new techniques that will help in low spending and reducing the time to provide the anomaly detection. The next study is about the automatic quantification of tumor hypoxia. It helps in building standardization instrument for measuring hypoxia. Next, we will see the education dementia immersive experience by Deakin University researchers. As we know, about 40,000 people in Australia are living with dementia. Dementia is nothing but loss of memory. Deakin University has taken up the initiative to research in the field of dementia to provide the families who can understand the feelings and experience of patients with dementia. The study in the Education Dementia Immersive is all about building a VR system to help the caretakers, the family members who can understand the feelings of patients. Next, we will see the research conducted by University of Sydney and Fudan University on brain health. The partnership between university is mainly focused to adopt the AI in improving the brain health. The collaborated work is called as BISA, abbreviated as Brain and Intelligence Science Alliance. This study is mainly focused to help the children who are affected with the brain neurons. Next, we will see how there is a development in Australia over the years, especially in terms of artificial intelligence in healthcare. The table shows there are about 52 formal partners to the date, commenced in 2017, mainly focusing on studies in artificial intelligence in healthcare. There are about 5 state departments of health only in Australia. Universities such as Macquarie University, Melbourne, Queensland, UNSW, University of Australia, University of Adelaide, and Flinders. There are various international universities who are focused in the same sector as Stanford, Oxford, Toronto, and Liverpool. By this, we can come to conclusion that most of the universities are giving more importance towards artificial intelligence, focusing on healthcare to have early adoption of AI and make difference in the lives. As we know, artificial intelligence not only adopt the human skills, but they are also efficient and accurate. All of the algorithms that which are used to build are mainly of machine learning. Next, we will see the success factors of applications in healthcare. There are various success factors in building and one application and bringing it in up running market. About 73% of the applications to be successful depends upon the sufficient staff training for research, project proposals, the development of the projects, testing and deployment. Next, about 64% of the applications to be successful depends on the guidelines and legislation procedures. As we know, there are different ethical, state, and national laws that contribute. 64% of guidelines and legislation procedures contribute towards AI applications in healthcare. And finally, we can see that about 62% of the contribution is from high end technology, providing mature developmental models. Thank you. Now, my friend Aruna will explain the industrial contribution to AI in healthcare in Australia.
Hi, I am Aruna Sairam Manjunatha. I'll be explaining the industrial contribution to AI in healthcare in Australia. Australia has one of the world's most eager and fast growing group of adopters who use AI wearable devices. Let's take a look at the table on the screen. When the following three countries are compared, the US, Australia, and the European countries, we can see that Australia has 12.7% device penetration in March 2016, 13.6% in June 2016, 14.8% in September 2016, and 16.3% in December 2016. We can see that Australia has the most growing wearable device penetration compared to other countries. Now, within Australia, when we see the usage of the wearable fitness devices, let's take a look at how these wearable devices are used by people. 21% of the Australians use smartphone only, whereas 12% of Australians use wrist devices only. 12% of Australian citizens use both smartphone and wrist devices, whereas 56% of Australians use neither. Moving on, let's focus on some of the most profound companies which have contributed to the study of artificial intelligence in healthcare in Australia. Google awards $1 million to the University of Sydney to invest in the study of AI in healthcare. The Westman Applied Research Centre, which is a part of the University of Sydney, has won Australia's inaugural $1 million Google Incorporation's Artificial Intelligence Impact Challenge for a transitional digital health program that uses digital tools to prevent heart-related problems. This is a great contribution made by Google to the development of AI innovations in the field of healthcare in Australia. IBM is another one profound company that has spent $10 million to build Artificial Intelligence Center to study AI in healthcare at Melbourne University. IBM, one of the tech giants, and Melbourne University establishes a $10 million AI center focusing on using the technology to solve medical sciences challenging problems. The center has already launched 49 plus projects and also hosts 60 AI scientists from Melbourne Institute of Technology. The table on the screen shows some of the multinational AI startups that have contributed to the study of AI healthcare in Australia. The financial figures in the table shows the funding made in Australia in US dollars. iCarbonX is the top company which is based in Hong Kong, has funded $120 million. Flatiron Health is the second top company which is based in New York, has funded $95 million. Benevolent, based in London, has funded $85 million. Recursion Pharmaceuticals, based in Salt Lake, has funded $70 million. Butterfly Networks, based in Guildford, has funded $68 million. Apixio, based in California, has funded $65 million. Pathway Genomics in San Diego has funded $57 million. Arteries Incorporation, based in San Francisco, has funded $55 million. H2O, based in California, has funded $53 million. Ginger, based in San Francisco, has funded $45 million. Infervision, based in Beijing, has funded $30 million. Babylon Health, based in London, has funded $20 million. And Gauss Surgical, based in California, has funded $20 million. Let's take a look at some of the industrial statistics in Australia related to AI in healthcare. The survey titled Assessing Asia's Growth Potential in AI, carried out by Microsoft in partnership with IDC Asia in 2018, shows the AI adoption in Australia. Over 1,600 commercial enterprise leaders in Australia agreed that AI would permit the fee of innovation enhancements inside their agency to multiply 1.5 times within 2021. Looking at the chart, we can see that 14% of the companies have already adopted AI, whereas 54% of the companies have just commenced undertaking artificial intelligence at this point. 32% of the companies have not thought about adopting AI at all. Among the 54% of the companies that have commenced undertaking artificial intelligence at this point, let's assess the statistics of AI skills development in employees. We can see that 47% of the companies have agreed to make investments in increasing worker abilities to use AI, whereas 3% of the companies are not willing to train employees in AI technologies. 50% of the companies are yet to take any decision in assisting their employees to use AI technologies. This shows lack of skills and interest to train employees to use AI is also one of the reasons for Australia lagging behind in adopting AI. Let's take a look at the statistics which shows the opinion from enterprise leaders and doctors in Australia. This study was conducted by Robin W. in 2018, and he discovered that Australian enterprise leaders and employees normally hold fantastic opinions about artificial intelligence in healthcare. The orange tab shows the enterprise leaders and the green tab shows the doctors. 63% of enterprise leaders and 70% of doctors agree that AI should be adopted in healthcare. 63% of Australian enterprise leaders and 70% of Australian doctors agree that AI should be adopted in healthcare, whereas 11% of enterprise leaders and 20% of doctors disagree that AI should be adopted in healthcare. And 25% of enterprise leaders and 10% of doctors neither agree nor disagree regarding adopting AI in healthcare. Now, my friend Pooja will be explaining the government contribution to AI in healthcare in Australia.
Hi, my name is Pooja, and I'm going to talk about the government contribution to AI in healthcare in Australia. The change in Australian mindsets. According to ethics specialist Richard Kelly from PwC Technology, for the endorsement of AI in the healthcare systems in Australia, the mindsets of people need to be changed from traditional thinking to modern and advanced thinking. Previously in healthcare, the systems used to treat patients was a reactive system. This system let patients be treated only when there is a crisis. The advanced system involving AI includes a proactive system, which targets on preventing the crisis and concentrates on the current wellness. For this to be implemented, the systemization of the infrastructure, devices, platforms, and data is necessary. AI in healthcare means developing technology that have augmented human skills. Therefore, the healthcare sectors now are increasing adopting AI to improve efficiency and performance. Moving on to the challenges in hospitals before using AI. According to medical hospitalist Harun Kasim, when he was addressing a summit at AI Med in Australia, he posed some challenges to innovators, asking if there is an AI solution. He said, the potential impact is huge. In aged care, 1 in 2 people are sent home with the wrong medications. There are 230,000 adverse effects and 2,000 deaths, costing the health system $1 billion a year. He outlined the challenge at the AI Med briefing, noting that the problem lies around the complexity of the case and the lack of standardization. While he noted that hospitals do have clinical emergency response systems, but these have limits. Moving on to the Australian government's initiatives in AI in healthcare. There are a lot of initiatives that Australia has taken, some of which are mentioned here. So, the first one is aged care sector. It can be surely said that Australians would benefit from the technology of AI if there are proven benefits. According to a healthcare professional, Mr. Michael Costello, AI can be beneficial to show a path to the aged care society and provide better quality of care. A number of government departments have taken initiative to a front door service to aged care called My Aged Care. It normally gets 1.5 million calls every year and about 246,000 new sign-ups every year. Presently, Australian government supports 1,824 aged care centers. Now, moving on to the training centers, the Australian government has led training centers for medical technologies using cognitive computing like the ARC Training Centre driven by the University of Melbourne along with the IBM Research Australia. According to Professor Maskell, the merging of industry and government will definitely lead the technological specialists in Australia to drive a significant research attempt to find advanced methodologies using AI in the healthcare of Australia. To encourage the experts working on this research, the federal government is presenting a funding of $4.1 million and hoping to accelerate the next generation medical technologies based on AI and machine learning. So, these are the few initiatives that we saw. Moving on, it's the Australian government's projects in AI. These are as well a part of the initiatives driven by Australian government. Australia is highly prompt in acknowledging the issues and problems related to AI, like demanding questions related to society impacts, technology, security, and ethics. In the federal budget of 2018, Australian government made an announcement about a 4-year deal to make Australia's capability in AI and machine learning stronger. This deal, initiated by the Australian government, consisted of the commitment of 3 important topics covered in detailed information reports. This was undertaken by the Department of Industry, Science and Innovation, and these reports were made by Data 61, which were AI Standardization Roadmap. The second one was an AI Ethics Framework, and the third one was an AI Technology Roadmap. Predominantly, there is a project based on human rights and technology, which is being conducted on a large scale by the Australian Human Rights Commission. This consists of processes related to public consultation as well. This is the second project that is mentioned in this slide, and the third one are the national standard bodies. So, in Australia, there are different NSBs which are an important component of the architecture of AI regulations. For example, Standards Australia is one of the national standard bodies, which is NSB, that emphasizes on committing towards steps taken with the international standardization and their merging throughout different economies. They can accomplish a co-regulatory embodiment where the industry and government agencies take part in a formal way. Moving on, these are the principles of integrating AI. These principles are followed by Australian government in every project which is a part of integrating AI in healthcare of Australia. A very important advantage of AI is early identification and diagnosing a disease using the advanced technology of AI. Using AI, computers can detect even the tiniest abnormalities in a human body, comparing it with another individual or a larger population. CT scans can be straightaway analyzed using machine learning algorithms, and the Government of Queensland, Australia has implemented the use of a patient admission prediction tool developed by CSIRO, which using AI predicts the number of patients that will be admitted, improving in hospitals, which therefore results in decreasing in the wait time for patients in almost 27 different hospitals in the state. This has been adopted by the Queensland government in Australia, and it is a big success over there. According to Professor Koira, as there was no established initiative by the Australian government that was focusing on AI in healthcare, the Australian Alliance for AI in Health came into action. This initiative had four principles that it emphasized on. The four principles that we can see on the screen, which are ethics, safety, and quality, is the first principle, workforce reskilling is the second principle, consumer healthcare is the third one, and the fourth one is precision healthcare. When it comes to adopting AI in healthcare, there are some standards and there are some clauses which are given by the government and which they have to follow. So these legislative clauses are very important and authored by the government bodies that give information about the usage of artificial intelligence by agencies. So one of them is mentioned over here in the slide is Section 6A of the Social Security Administration Act 1999. So it is stated by the Australian government, which says that the first point says that the secretary may arrange for the use under the secretary's control of computer programs for any purpose for which the secretary may make decisions under the social security law. And the second one of the clause says that a decision made by the operation of a computer program under an arrangement made under subsection 1 is taken to be a decision made by the secretary. These clauses state the permission to government agencies to use computers for making decisions. Different departments in Australia, like the Department of Border and Protection, Social Services, Health and Education, are allowed to use automated systems to make decisions. However, this law in the Australian legislations clearly mentions a vital characteristic of AI ethics, which states that a human being must be responsible for any decision that is made using an automated system. So these were the one of some of the clauses that are used as a part of integrating AI into healthcare systems. So from all of this research, the findings are as below. So according to the research and prediction conducted by PwC, so by the year 2030, the global GDP will rise higher up to 14% more than the previous GDP as a result of advancement in the reinforcement of AI. There is possibly of an interruption in healthcare. There is a possibility of interruption in healthcare due to the vast amount of healthcare data that is available. The reason behind the huge size of the healthcare dataset is because it includes datasets as the size of the population of the country, case histories of thousands of patients, digital data that is captured real time from the smart devices like smartphones and wearable medical devices, and also sources from doctors' prescriptions that are handwritten and not structured. According to the research conducted by Professor Koira, that included development of models which were an outcome of the real experience of patients in the past to facilitate the care of complex patients, which had restricted experimental and observational intervention evidence. This facilitates the rise of patients, improved health outcomes, and a better health service delivery as well. In addition, it also enhances the user experience while interacting with the health sector. According to PwC, artificial intelligence is going to have a great influence throughout the world's economy. They have also predicted that the global GDP would get a high rise of about 14% greater than before, which is mentioned in the beginning. So, one of the main reasons behind the increase of GDP is definitely the adoption of AI in Australian healthcare systems. With all of these research in academic institutions, industry, and government, we came up with some conclusions. So, the initial studies of this report gave us a brief understanding that Australia is an early adopter for the big change in medicine field. Since Australia is believed to be the early adopter, the three major sections of people in the society, government, researchers, and students industries also showed high interest of exploring AI in healthcare. The study of AI in healthcare is also helping in building human-like robot with augmented human skills, which is positively impacting the medicine areas with challenges of robots over taking over human work. The adoption of AI in healthcare in Australia is expected to follow certain legislations and standards in Australia. And then after that, we saw about different projects that were led by various academic institutions, industries, and government in Australia about integrating AI and adopting AI in healthcare. Lastly, we also saw the rate of companies that are willing to adopt AI and develop the required skills for it. We saw that only 3% are not willing to do so, whereas 47% of the industries are willing and have agreed to adopt AI in their systems, and 50% of the industries are yet to take a decision. So, this was all about the adoption of AI in healthcare in Australia.